Okay. Um, Dr. K versus Dr. Mike.
Dr. Mike.
It's very rare that I sit in front of someone who has significantly more experience discussing health to a huge audience online, because there's not many people doing it, period. But to do it for the amount of time that you've done it, not just years that you've been online, but also when you stream, you spend a lot more hours in front of the audience. For me, when I make content online, we hyper edit a fast paced moving video, 10, 15 minutes. Now I'm entering a little bit more into the podcast space. How do you do it?
Jasmine is not better at COD than me. She is pretty bad at it.
And not get in trouble.
So it's a great question. So we'll see how much trouble I get into.
Well, let's get into troubles today. That'll be fun.
And so I think a couple of things to keep in mind, right? So I think just being super careful about what you say, what you don't say. I think steering clear of like medical advice. So I think the way that I kind of frame things is when I make content online, I almost think about my target audience as like residents. So if I'm talking about, let's say, a clinical condition like borderline personality disorder, I frame it in the way of, okay, if I was teaching a group of residents or medical students or even pre-meds, how would I explain this condition? So that's really what I usually think about. And then I'll prepare lectures and just keeping it more educational.
What about when you're having conversations with a guest? And I've struggled with this myself a lot. I've had...
Look at this stupid fucking kid. Good kitty.
Let me see. Get fucked. Well, that is a good kitty indeed. Thanks for the donation, Oatgoat.
difficult conversations on this podcast where someone brings up either a past trauma or you could see that they want to talk about a past trauma. And I get uncomfortable, and I'll explain what I mean by uncomfortable, that I don't want to become their doctor on camera, right? So I know what next question my doctor mind wants to ask, but I also need to be hyper aware that I don't ask that question and become their doctor. So how do you kind of ride that line and make sure you're doing this ethically?
Yeah, so it's a great question. So I think we have a pretty rigorous informed consent process that not many people are aware of. So, most people will see like the final product, but we go through a rigorous informed consent process. We also have like a boundary setting call before we meet someone, or we offer a boundary setting call for anyone who wants to take advantage of it. And that usually is a chance for people to say, we don't want to talk about this, or I do want to talk about this. And I think the main thing to keep in mind is that if you think about your job as a physician, the process of a diagnostic interview is very different. So you're usually thinking about what are the alternate diagnoses, you exclude certain kinds of things, you assess every patient. So for example, like for psychiatric intakes, we assess for suicidality, homicidality, psychotic symptoms. So if you really look at the process of diagnosis, it's not just talking to someone about their life. It's literally assessing for any number of conditions. And I think that's where it gets a little bit tricky, because talking to someone about their life, which is usually what we do, and then sometimes we'll also educate about conditions. So there's absolutely like a concern there. I think we try to get through it by using a rigorous informed consent process, really taking a more educational approach. And it seems to have worked pretty well so far.
Yeah, there's many times where I know that there's a question to be asked that will be very powerful and would create some emotions, but it feels manipulative to ask it, if you will.
Yes.
So I'm like, I don't think I should do it, because I don't think this is, now I'm crossing that boundary. And I can even talk about a specific episode where that happened. I was interviewing Steve-O, and he was talking about his childhood, and he was talking about how it's impacted him and his decision-making to be a daredevil on Jackass. And there's probing that I wanted to do to figure out how he got to this place where he's at. But I felt like if I did that, I would be putting my doctor hat on. Do you agree with that notion, or do you think that's a safe space?
I think we have a challenge, right? So like everyone says, so we have a mental health crisis. Suicide rates are increasing, depression, anxiety. We're seeing an evening out of body dysmorphia between men and women. We're seeing an evening out of ADHD, equality in all things. So we've got this mental health crisis. And the question is why, right? And this is where we have organizations that will advocate for destigmatization of mental illness. So the question becomes, how do we do that? Right. So now, because mental illness is a little bit different, because we've been so careful about talking about, which I'm all for, right? So I don't conduct clinical interviews. I never have my patients on stream or anything like that. And at the same time, like, what does destigmatizing mental illness literally look like? Like, how do we do that? So people can have awareness campaigns, which is like fine, but I don't think that that's worked, because that's what we've been doing. And this mental health crisis has happened on the watch of everyone who is focused on public health, medicine, or whatever, right? We've got advances in neuroscience, we've got all this kind of stuff, and it's not working quite the way it's supposed to. So part of what I think is really important is that if we sort of think about it and we think about the concept of mental health like equity, right? So physical illness and mental illness should not be treated differently. So a lot of people, like, would you be thinking that question if you were talking to someone about their experience of being a cancer survivor, right? So we don't have those same hesitations. If someone has a heart attack, or if someone has a complication with labor, or is raising a special needs child, we're not like very, very touchy-feely about that. We're open to discussing some of our struggles if people feel comfortable.
Of course.
And the whole point is, I think that's the way we should be around mental illness, is that people should be able to discuss, hey, I struggled with this, I struggled with anxiety, I struggled with trauma, here's my story. And then to also recognize that the practice of medicine is different from talking about your experience of life. And so the North Star that we try to use is people should be able to come on and talk about whatever they feel comfortable talking about. That we don't want to say, we don't want to put guardrails that, okay, you can talk about your difficulties at work, but the moment that you mention something that touches mental illness, we're actually going to muzzle you. Because that's sort of what goes on right now. And like, no wonder we have a stigma on mental illness when literally no one talks about it.
I guess I have two follow-ups on that. One, for the mental health stigma of it all. I definitely think that if you look back 30, 40 years, it was viewed as a weakness. If you talked about mental health, if you said you had a mental health issue, you were labeled certain adjectives that were not nice. is that the sole reason that we have, or the major reason that we have this spike in mental health conditions and diagnoses right now?
Not at all. I mean, I don't think nothing is the sole reason.
Well,
Everything's
majority, like the heaviest reason. If you
So
will.
I think it's a big reason, right? So if we sort of think about, let's look at like men, for instance. So men are very reluctant to engage in psychotherapy. Like historically, 70% of patients have been women. And so the question is why? So we absolutely have a stigma against mental illness, especially when it comes to sort of like some masculine identity things. So men are expected to be independent. They're expected to be self-sufficient. So the concept of getting help is almost, we're conditioned to not get help. And then the other problem is that we tend to have very poor understanding of mental illness. So on the one hand, we'll have people who will not really understand what it's like to truly be in a depressive episode. So from the outside,
Any timeline for when the Islam Exposed videos are going to be uploaded? Probably in the next few weeks.
best that they can do is relate it to their struggles, which is that when it's hard for me to get out of bed, what I need to do is just give myself a swift kick in the ass and get out of bed.
Yep.
And that works for you unless you're struggling with something like a real mood disorder. So a lot of people don't understand that. And that's part of the reason that we have the conversations that we have, is because when you have a full conversation with someone about their experience of whatever it is that they want to talk about in life, whether that's spirituality or career or mental health, whatever, then we start to, I think what we've seen in our communities, people are like, wow, this is like a very humanizing experience. This isn't bad. I never realized, holy crap, I am this way. This is something.
What do you think about Clue 2? Is it woke in your opinion? I was afraid to play it because a lot of people had negative opinions, but I really enjoyed it. It was great the way Neil showed both sides of the conflict, and in the end I liked Abby more.
People called it woke because they're retarded. I don't know how that game is woke in any way. Like, again, Ellie was a lesbian character in the first game. Nobody complained. And then when the second game came out, everybody started complaining about it. I think all of the complaints really revolved around Joel dying. And then they just tried to justify their hate for the game by rationalizing it in other ways. A lot of people who played The Last of Us 1, they're like, I think they played it either as kids or they're like really emotionally fragile adults. And then they liked Joel so much that when he died, they just threw a temper tantrum. And then every little thing about the game they tried to complain about. Oh, this game's woke. There's a female character that has muscles. Oh, there's a lesbian character. This game's woke. Oh, one of the characters is trans. Oh, woke. Like, none of it mattered. None of it felt like weird and shoehorned in. It was just a fucking story about revenge and regret. It's not like they just had token characters that were there for representation's sake. And in every single way, the game was objectively better than The Last of Us 1. The controls were massively improved. The gameplay was massively improved. The AI was much better. The level design was way better. The game was much longer. The story was more complex. There was more characters. The pacing was much better. You actually got to play the game rather than just walk around for like 20 minutes and then eventually you fight zombies. Like, everything about the game was improved, and it's still to this day the most violent game made yet. It's extremely gruesome. Like, yeah, Mortal Kombat has people ripping each other in half, but it's not like the kind of realistic, grounded violence that you get in The Last of Us Part 2. So it's really weird that people were calling it, like, woke and blue-pilled and shit. Like, so yeah, everybody was just a crybaby over Joel dying. That's really it. Thanks for the donation, that Dan.
I've been struggling with. I thought I was always alone because the 2 or 3 people that I tried to talk to seemed to have no experience of this.
Okay. And by the way, I don't disagree with the notion of that it's important to break the stigma. I'm kind of just playing devil's advocate for creating the conversation.
Push, bro.
For the idea of talking about, let's say, cancer or heart attack in comparison to talking about mental health, on one hand, I see the value of that, right? That we should treat mental health like a physical symptom. Like, you have a broken bone, you need to go get it fixed. The same way that if you have a mental health issue, you can get it fixed and talk about it. But on the other hand, there's really subtle differences that are super important. For example, if a primary care doctor who saw a patient in urgent care for a sore throat ends up dating that patient, there's less of an ethical dilemma than if a psychologist or psychiatrist ends up dating their patient. Do you agree with that?
I don't know in a technical sense if I agree with that, but on a practical sense, sure. I think there's a very different level of clinical relationship. If you're evaluating a sore throat, which in a one-time clinical scenario, versus generally speaking, if you look at a psychiatrist or a therapist who has a long-term relationship with a patient, I think there's a big difference there.
Right. Like, you would, like, I guess one would check for conflicts before taking a patient on, whereas like I would never do that as a primary care doctor seeing someone for a sore throat. So I feel like there are some intimate differences between the two.
Oh, absolutely. So I don't think that they're one-to-one by any.
Why did you prefer in the end more Ellie or Abby?
Well, Abby. Ellie is like a crazy dumb bitch. And Abby is just a much more sensible, reasonable person. Thanks for the donation, though, Dan.
Any means. Yeah, I mean, so I think that often
I'm going to skip mindfulness of enlightenment.
did spiritual pursuit.
Oh, tell me more.
So if you look at meditation, right? So we use mindfulness for, clinical treatment. But if you really look at the development of meditation was designed to help people attain moksha, enlightenment, nirvana. This is why we developed it. So they were not interested in treating depression or anxiety. That's not why they did it. They did it to attain a state of superhuman bliss, let's say.
Can I ask you a question about that?
Yeah.
I don't want to lose your track, though,
Yeah.
so we'll come back to that. Isn't, like, it's hard to judge why things were created in the past. It's hard to even look back at history 100 years ago and try and gauge.
I mean conjunctive traits together justifying harm to individuals. Egg, non-human plus having mentally disabled human-level sentience. But in humans, they don't view mental disability as morally relevant, so how can it be for non-humans? Isn't that contradictory?
Not... Yeah, let me see. You could argue that it's another trait as opposed to them being human. Sorry, you could argue that it's another trait that they value because, again, well, wait. Well, if they're saying it's a conjunction of traits, so human and yeah, if they're saying they value humans because of the trait human and sentience, like human level of sentience, but they'd still protect the human, but they wouldn't protect the animal. You could say it's a bit of a contradiction because, wait, let me think. Yeah, so if we go to name the trait, they say it's the conjunction of trait, human, and intelligence. And they'd be fine with killing a animal because it's not human and it's not intelligent, but they wouldn't be okay with killing the human because it's human, even if it's mentally disabled. It's not necessarily a contradiction because, again, it can be and or. Like, I would say the thing to do there would just be to show that they don't care about the trait human. So you can get rid of that trait. So if they wouldn't holocaust, super intelligent, high sentient cows that are like the same level of intelligence as a human being, then clearly the trait human doesn't matter. So you can get rid of one of the traits so that it wouldn't be a conjunction, or it could be a conjunction of other traits. Thanks for the donation, Curious.
Like, for example, why I did something yesterday is hard for me to judge.
Yeah.
So I'm wondering how much more difficult it is to judge why someone created something thousands of years ago. So I'm going to pose a question to you to be more specific. Is it possible that the reason meditation was created was to ease symptoms of anxiety, depression, they didn't have these diagnoses, and they called it enlightenment?
It's possible.
I mean, isn't it reasonable to say that?
Well, it depends. I mean, do you trust the people who made it? And if they give you a reason, so if I invent something and I say, I invented this bottle, and this bottle is to drink water from, how much faith would you put that the reason I invented this bottle is to drink water from if I tell you this is why I made it, as opposed to this is a bottle for my piss if I can't find a toilet?
Yeah, right? I think that applies in the present or in the recent past. I think when you look back so far, time-wise, their definitions and understanding is going to be greatly different. So they would never have said mindfulness is a treatment for anxiety, depression, because they didn't have those terminologies.
I hard disagree there.
Really? So you think that existed? Like the idea of major depressive disorder, generalized anxiety
absolutely,
disorder?
right?
Okay.
So we have, for example, like Ayurvedic medicine, which diagnoses mental health conditions.
The problem is he's using it in a modern context. I will agree with Dr. K here that they did have the concept of anxiety or depression in ancient times. They just probably didn't call it anxiety or depression. Even, like, depression's a fairly recent terminology. If you go back in the early 20th century, I don't think the term depression was ever used. They used to call it melancholia. So anxiety and depression, it has affected human beings since humans have existed. So they would have had like a word or term or understanding of it. It's just that they wouldn't have used that terminology.
Right, so you have
I'm not familiar with this. Tell me about this.
Yeah, so you have medical systems. So this is the big thing, is that medical systems would diagnose things like depression, bipolar disorder, stuff like that. And the reason that I say that meditation was not developed to treat mental illness is because they say that they're like, I invented this thing to help people attain enlightenment, get rid of suffering, and then along the way, you will treat your mental illnesses. But that's not the goal. So the way that I understand it, and the reason I trusted it, because that's what they say, right? So they were very clear about, and then who are we to say, oh, they didn't understand these terms and things like that. I think that's actually sort of judgmental and
I would ask him, who is they?
I'm not calling you that, but I'm just saying to look back at them and say they didn't know better, they didn't use this language, and we are interpreting what they said based on our understanding, I think is not a good idea. So what I would say is they're very clear, right? So if you read something like Patanjali's Yoga Sutras, so this is sort of like the seminal text on yoga, and he kind of says like, okay, here's how we're going to talk about enlightenment, and here are the different ways to attain liberation. Here's like some of the challenges from attaining liberation. Here are the malfunctions of the mind, or not malfunctions, but the ways in which the mind can operate poorly. And then on the flip side, we have a comparable text of Ayurveda or something like traditional Chinese medicine. Well, they'll talk about mental illnesses. So they'll talk about things like cerebral palsy or malfunctions of the brain or things like bipolar disorder. And they'll have treatments, like usually herbal treatments and other kinds of things, where they separate these two. One is a rog, or an illness. And the way that I kind of understand it is the use of medicine is to get you from negative 100 to 0, to remove something that is malfunctioning. Meditation is a process to go from 0 to 100. So you can still increase your number. So if you start meditating at negative 100, you can get to 0. But the practice was not designed as a treatment. It was not designed to bring people to baseline. It was designed to bring people at baseline to above baseline.
They had diagnoses that many years ago of cerebral palsy?
Absolutely.
How did they describe cerebral
They did not. That is a lie.
palsy 1,000 years ago? And by the way, I'm saying 1,000 years completely uneducated. I have no idea. 5,000 years.
Yeah. So I don't know specific. Let me just think about what examples to use. So
Because the reason why I'm so
Yeah, so Dr. K is just bullshitting here.
skeptical about this is I look at how mental health was discussed in the 1900s of like histrionic personality disorder versus hysteria in women. Like very judgmental, very culturally based at that time. You're saying that didn't exist 5,000 years ago?
no. So dude, East and West are completely different, man. Like it's like night and day.
Okay.
So let's.
Bro, to this day, in India, women are considered second-class citizens. You're telling me in India 5,000 years ago, they wouldn't have biases against mentally ill people where rather than thinking they're suffering from some sort of mental illness, they're not plagued by demons or something?
Let me just give you a couple of examples. So like if you look at an Ayurvedic textbook, they had a super cool diagnosis for diabetes.
Okay.
They say go pee next to an anthill. If the ants drink your urine, then you're diabetic. Right? So they had a lot of understanding of physiology.
What did diabetes mean?
This is fucking retarded. Dude, this has nothing to do with Ayurveda. Different cultures have discovered diabetes in different ways. The Greeks discovered diabetes by seeing wasting in certain people, and they would drink their urine, and if their urine tasted sweet, they would diagnose them with diabetes, this wasting disorder. So, like, no shit. What does this have to do with Ayurvedic medicine having the ability to treat mental illness?
To them. Because to me, it means checking someone's hemoglobin A1C and seeing it fall in a specific range. But if I'm trying to put myself in their shoes, I have no measurements of that. I'm not even aware of bacteria, right? Antibiotics don't exist.
I don't know. I think they have certain herbs that have antimicrobial properties. They understand the process of sterilization. So I think
They
they
do?
Oh yeah.
I mean,
So, again, ancient cultures understood that diseases occur through transmission. They didn't understand microbes. They didn't know they didn't have germ theory back then, but they knew that things that are unclean that touch an open wound would lead to infection. I don't even know what the fuck he's trying to suggest here. Like, they keep jumping back and forth between these different ideas. Like, Dr. Mike here is trying to ask him, how in the hell would ancient people know anything about, like, schizophrenia, histrionic personality disorder, depression, bipolar disorder, and not just see it as, like, being afflicted by demons or something, and, like, have somehow developed this unique treatment method where you use meditation to treat it? And then Dr. K says, oh, well, they knew how to use herbs to, sterilize things. Like, what the fuck does that have to do with the question?
we just did a video on the history of the first gentleman who recommended washing hands in between treating morgue patients and delivering babies in
That's
the
in the West.
1800s. What was that? 1850s, yeah.
I mean, so I may have a rose-tinted glasses when I look at Eastern medicine. I don't think Eastern medicine is perfect by any means, but they absolutely do. Like, so even if you look at in Indian culture, this is how well they understood microbiology. So in Indian culture, we eat with our hands, right? Okay. So we also don't have toilet paper. So anytime
I don't know that,
So like if you look at like ancient India, like not just toilet paper is a relatively recent invention, of course. So how did people in India clean themselves after having a bowel movement? They would wash with their hands. So and then this is how well they understood microbiology. You never eat with your left hand. You always eat with your right hand, and you always wash with your left hand.
That's funny
That's not unique to Indian culture. Other cultures figured that out, dude.
to me because you view that as like
But by the way, what does this have to do with the original question? How did they develop these systems of treating mental illness? Has nothing to do with that.
them practicing microbiology. I view that as them stereotyping and being rude to people who are left-handed. No, I'm just saying.
Yeah, no, I mean, but there's a
Like they
reason.
were aware of the
No, no,
bacteria, but they weren't aware that some people prefer to use
No,
other-
they were absolutely
Okay.
aware that they're
Okay,
left-handed
got it.
people. What they realized is, I don't care if you're left-handed, there needs to be a convention
Got it, okay.
where bacteria that come out of your ass should not be put in your mouth.
Sure.
And that is more important than handedness, because they literally
They didn't understand what bacteria was. Here he is applying modern wisdom to ancient practices. They didn't know what bacteria was. They just noticed a pattern that if you expose yourself to certain things, you increase the likelihood of disease.
lived in a society where there were endemic diseases like cholera and stuff like that. So for the sake of sanitation, they would always have you eat with one hand, and you never use this hand. And this is your washing hand, and these are completely separate. So one hand touches the back of the GI tract, and one hand touches the front. So they had an understanding of microbiology in that way. I don't know if
Was it microbiology
They didn't have an understanding of microbiology, you idiot!
or did they just see cause and effect?
probably more of cause and effect than microbiology, because this is where they also develop something very similar to the theory of humors. So they have like these concepts of elements. But the really interesting thing is what they basically, I think what they did is notice all kinds of correlations and then developed a heuristic system to explain those correlations.
Every culture has done this.
Question is now, is this a radical form of survivorship bias where we're remembering the ones that turned out to be right and are not pointing out the hundreds of correlations that they deemed as cause and effect and they were magically wrong? Like,
it could be. So now let's get into that. This is great. Okay, so let's look at that in a couple of different ways. So it's absolutely a possibility of survivorship bias. So let's also remember that there are a lot of things in Ayurvedic medicine that are not correct, right? So this is where, and what tends to happen is we don't propagate those. So, and then what ends up happening is a survivorship bias where the stuff from Ayurvedic medicine, like let's say ashwagandha or brahmi or meditation, these are the things that we now associate because we remove things like heavy metals in the usage of medicine. So there's something called Rasa Shastra, in which they'll use things like arsenic, mercury, things like that as treatment. But that is not nearly as popular, but that's absolutely a part of Ayurvedic medicine. So to say that Ayurvedic medicine is right, I think is a gross overgeneralization because there are 8 branches of Ayurvedic medicine. Some of them have scientific support. Some of them have scientific evidence that they're actually harmful.
So this is the fucking problem with using terms like Ayurvedic medicine. There is just medicine. If something works, it is just medicine. If something doesn't work, it is pseudoscience or quackery or bullshit. When he fucking uses terms like, oh, Ayurvedic medicine does this, it does that. No, that's not Ayurvedic medicine. That is just medicine. If it works, it's just medicine, and he's admitting that he's cherry-picking what he feels works, what he feels doesn't work. So this has nothing to do with, like, anything to do with Ayurveda. He's saying he's only selecting things that are actually, like, proven to work. So why is he calling it Ayurvedic medicine?
Now, there's even a counter-argument to that, which is that they may have known something about the usage of these chemicals that we don't. So
Stop dissing on India. Ancient India was indeed far more advanced compared to their peers. The Turks and the British came, pillaged, looted the country and plunged it into poverty and backwardness.
Yeah, I don't think that explains why people shit out outside in public. Thanks for the donation, Tommy Kunwar.
good example of this is if you go back 60 years ago and someone shows up and says, hey, you don't need to take an SSRI for your mental illness. You can sit there and meditate. And what would science have said 60 years ago about meditation?
That it's useless.
Absolutely, right? And that's what we did say. And so they figured something out that based on our modern understanding of biology at the time was literally useless, was so antithetical to everything that there was a revolution in biological psychiatry. We're like, this is complete BS. And we were so confident. And today it turns out that we're grossly wrong about meditation.
Yes. But again, are we just pointing out the one time we were wrong and we were actually right the huge majority of the time?
That is what I think makes Western medicine the best. So what makes Western medicine the best is we are the best at pointing out when we're wrong. That's what makes it.
So that's a scientific method, is it not?
Sure.
That's why people were mad during COVID that guidelines changed. And it's like, well, because we're pointing out when we were wrong.
So yeah, that's the scientific method. So I think this is the weakness. I helped organize a conference at Harvard a couple years ago, and one of my mentors was on the panel. And so this is a conference on integrated medicine. So there were a bunch of like Eastern medical practitioners there, and they kind of asked this question. They said, like, what do you think needs to happen for Eastern medicine to be more widely accepted? And my mentor, brilliant guy named John Denninger, said, you guys need to let your treatments fail. The problem is there's such a pissing contest between Western medicine and Eastern medical practitioners that no one on the East is willing to say, yeah, this treatment sucks. So the one thing that we do really, really well, which is I think why allopathic medicine, talking about selection biases, but let's talk about not the selection biases the reason that Western medicine is dominated so much is because we are so good at pointing out when our medicine is wrong. So if you look at things like thalidomide or, like that's such a great example of, oh my God, revolutionary medicine solves nausea. And by the way, we're never going to use it ever again, right? And so we're really good at that. And the biggest problem in Eastern medicine is they're so hung up on getting widespread acceptance. There's this ego battle going on between Eastern medical practitioners and Western medical practitioners that Eastern medical practitioners are not willing to say, oh, hey, by the way, this treatment actually sucks.
Is that because a lot of those treatments...
Because it's not based on the scientific method, and it's based on faith. It's literally just faith practices.
Are less based on the scientific method and are more culturally based?
So I think they're based on the scientific method, but they don't look at the mechanism in the same way that we do. So if we look at scientific method...
It's not based on the scientific method. It's faith-based.
The scientific method. It is having a hypothesis, testing that hypothesis, observing results. So I think they did that. That's not how meditation was developed, which is a whole different conversation about sources of transcendental knowledge and all this good stuff. But they absolutely applied the scientific method. So I don't think that you can develop as robust of a system of medicine. The big difference, though, is that we're really good at instrumentation. So in the West, it's not even technically a part of the scientific method. You can just, a child can make observations, test hypotheses, and come up with conclusions.
I mean, every time a child's learning to walk, that's what they're
Absolutely,
doing.
right? But they don't use a microscope. They don't understand anything about anatomy. So one of the things that I think we've actually mistaken is that in the East, they use the scientific method quite robustly. They just don't use instrumentation. So what they did is figured out all of these correlations and causations and developed these kind of heuristic systems. Even something like the concept of an organ is actually an abstract concept, right? It's not, you can make an argument that there's no such thing as an organ. Everything is just cells.
You can just say that about anything, about a cell.
Yeah, right.
That's like, I think Deepak Chopra's main thing is like, what is HIV? That's a concept that you've created in your mind. It's like, well, wait, hold on a second.
Yeah, so I'm not
I think
quite
it's very
there.
easy to go.
So I think they applied the scientific method, but what they didn't have was good instrumentation to elucidate the mechanisms, right? So they didn't have microscopes. But they were still able to make observations that when you have a diabetic, they're going to have sugar in the urine. And if you have sugar in the urine, you can test for that by if ants drink your urine.
Right. I think a lot of their scientific method approach is more so finding correlations and things that happen, which can be a form of scientific method, an introductory form of scientific method. But then in order to see if your correlation is valuable, can you affect it? Can you reproduce it? Can you generalize it? That is always missing.
In Eastern medicine?
Yeah.
I disagree.
Really? So
yeah,
tell me more
yeah.
about
So like, I mean, that's how they came up with these things like ashwagandha and brahmi and some of these things that we use in psychiatry, turmeric. So for example, the usage of bitter herbs in the treatment of diabetes. So what they did is, I think, right, so I wasn't there, you just have these texts where they'll say, okay, if you've got someone who's a diabetic, they need to eat bitter melon. So I think what they discovered is that when you feed someone a food that has an impact on their insulin metabolism, has an impact on their blood sugar, once this person eats bitter melon twice a day or drinks the juice of a bitter melon on a daily basis, the amount of sugar in the urine that the ants get attracted to goes down. They'll even taste urine to detect the sugar content using their tongue. And then I think they see that this leads to better outcomes over time. So I would not call that a correlation. I think at some point in the system of medicine, what you always have is an intervention, and then you measure that outcome.
That is a correlation. All research is correlative. Whether it be a randomized trial, a prospective cohort, all research is correlative. You're seeing what treatments are correlated with what outcomes. Like, he doesn't even understand the terms he's using. It's all correlative.
In some way.
I guess to me, unless you randomize and control for biases, it's not that.
That's a huge problem, but in the opposite way. So here's the key thing. So when you randomize, so we view the RCT as the hallmark, right? There's a huge problem with the RCT. So let's say I show you an RCT that says that cholesterol, let's say like cholesterol lowering medication. What is the outcome for an individual patient when you prospectively give them a cholesterol med?
You're talking about number needs to treat.
No, I'm not talking, yeah, sure. But so if I come to you
That
today.
like 99% of the time for the individual, it's not going to have an impact. But for the general population, you will see.
So this is really important to understand. So our system of medicine does not make predictions about individuals. It makes predictions about populations. So Ayurvedic system of medicine is completely different because they don't care about populations, they care about individuals. So their whole system, so if you think about random.
Yeah, okay, so that is just fucking stupid. The only way you can actually tell if a treatment is effective is if you test a population. If you test an individual, there's so many confounding variables that could be at play, like genetics, whether or not the treatment is taken properly, diet, sleep, like there's so many different factors that if you only do a treatment on one single individual, you don't know if the treatment that you're giving them actually had an effect and it wasn't some other confounding variable. That's why we have, well, that's the main reason we study populations, not single individuals.
Controlled trials, what we're literally doing in that trial is removing the individuality from our system of medicine, which then creates a problem of external validity. So the basic problem of our studies is that we can do a study on 10,000 people, but you know this is a clinician. This is why we need clinicians, because your human brain needs to take all of this data and then translate it to apply it to an individual. So in the Ayurvedic system of medicine, they think that randomized controlled trials are the antithesis of practicing medicine.
Can I explain why I heavily disagree?
Well, that's just fucking retarded. You're an idiot.
Yeah.
Well, I agree with, first of all, the notion of why we need clinicians, of taking generalized concepts and individualizing it to the person in front of us 1,000%. And I think that's what my residents get wrong the majority of the time. I just did a video.
This guy is literally saying the gold standard benchmark, randomized trials, are bullshit. Like, that is insane.
On this, because the idea of number needed to treat, just why I brought that up, is because it's a topic where, for example, lowering blood pressure, we see population-based, controlling it to a certain number will prevent 30% of heart attacks and strokes. But for the person sitting in front of you, 98, 99% of the time, it's not going to do anything. So the question of why I still, the reason why I think randomized controlled methods are still the best for the individual is because we're throwing out the baby with the bathwater.
What does that mean?
We're throwing away randomized controlled studies because they're imperfect to the individual. I think we need to look at it deeper and say, right now, this is the best knowledge we have for the general public, which will ultimately be the best for you because this is the best information we have. In the future, as algorithms, as information gets better, I think we can better individualize randomized controlled studies so that we can run simultaneously thousands, millions of experiments to know instead of 80 patients I need to give this blood pressure medicine to prevent the heart attack, only 10. So now I'm targeting the therapy more towards the individual and less towards the general public.
But so then ideally what you would want is not even a randomized controlled trial. You would want trials on an individual, right? Because that's when you produce perfect correlation between your scientific method.
You can't. Like, that's the thing. You can't. Randomized trial on an individual. What sense does that make? How do you randomize one person?
Really not.
Explain that to me.
Too much bias when you're treating a single person.
But isn't that what you're looking for? Is you want an amount of bias that is specific to the person.
Okay, this idiot doesn't understand what bias means. Oh my god.
So let me give you an example.
I think bias works both ways.
So let me ask you a question. So let's say, so we now have some of these services in psychiatry where you can do genetic testing on a person.
Correct, to see which medication is going to have the best.
So do you think that those kinds of these are not recommended by the American Psychiatric Association?
I just had a patient bring this in last week.
Yeah. So I don't use them usually in clinical practice because the data does not show that using these services in randomized controlled trials is which is hilarious. Okay. Right. So I'm with you there. But let's say, like, theoretically, if we could get to a point where that did work and we can recognize that, okay, this person has this kind of serotonin transporter gene and this kind of medication is effective, do you think that is that the kind of goal of personalized medicine, is to create a system of understanding this
By the way we would discover that is with randomized trials.
person is an individual, not worrying about the population. It's what are your polymorphisms, so we can figure out the perfect medicine for you.
Yes, but the only way we can get there is with randomized controlled trials.
How so?
In order for us to know that this works on this person.
Oh, we have a randomized control trial that this is effective for lots of people. Yeah. So the methodology is personalized.
Yeah.
And then we are doing a randomized control trial on personalized methodologies
Correct.
to see that personalized. That I'm with you 100%. Okay. So when I look at
The Dr. K is a fucking moron. If he's going to say, okay, certain medications aren't going to work on certain groups of people because they have like a certain gene mutation, then you run a randomized trial on people with those gene mutations to see if that's actually the case. Like, what a fucking idiot.
the Ayurvedic system, I think they're closer to that personalized methodology.
don't you feel like there's so much bias in that approach though? When they try, like for example, I had Dr. Gundry on my podcast who makes a lot of claims that disagree with a lot of the big institutions, the American Academy of Family Physicians, United States Preventive Task Force, the American College of Cardiology, et cetera. And when someone presents information that disagrees with large bodies of evidence or large bodies of groups.
I'm gonna send this over to you, Dr. Avi. This is like actually fucking insane.
You need to show me amazing evidence to show why you know, but the rest of the people don't. Like, you need to show me corruption on their side. You need to show me why you believe what you believe, what evidence you're looking at, et cetera. But when you're treating one person, to make your treatment successful doesn't require a lot of evidence.
How are you defining evidence?
In the statement that I made, evidence that I need to know that they're telling the truth is randomized controlled data.
So how can you have randomized controlled data on an individual?
By scaling it.
But then it's not on an individual, then it's on a population.
It's individual population medicine. Because that's what an algorithm would do.
So you're talking about doing an RCT on individualized medicine versus population-based medicine.
Correct.
Yeah, but I mean, I don't think we're disagreeing here, but what I'm kind of pointing out is, so let's talk about clinical practice, right? So when you know what works for this person, you have a pile of RCTs, but then you as a clinician individualize your treatment.
Of course.
Deviate for protocols to get the best clinical outcome.
Correct. And this is a practice, it's an art, two doctors.
These two ideas are not at odds with one another. There's an understanding that not every single person is going to react to the same treatment in the same way. So these things aren't at odds with each other. You can have a randomized trial where, generally speaking, you will see this outcome, but if you're treating an individual patient and they're getting like a bad side effect from the medication, you change the treatment. How is that at odds with the idea of a fucking randomized trial? What a fucking moron.
May recommend two different treatments and both be acceptable.
So in this situation, how would you describe what you're doing? Would you call this individual practice of medicine? Would you call this
The art of medicine.
Okay.
Like, by the way, here's what he's actually trying to suggest. He's saying the way medicine should be constructed is you just find a single individual, you give them any kind of treatment, and then based on the outcomes that you see from that treatment, you assume that that treatment is working, quote unquote, for the individual. This leads to so many fucking problems, and this is how randomized trials have proven things like homeopathic medicine are bullshit. You can give somebody a quack bullshit treatment that doesn't actually work, and you can see good outcomes. So let's say we're trying to cure somebody's depression, okay? And we say, oh, you're feeling depressed? Take this pill, okay? This pill could contain an SSRI. It could contain sugar, could just be a sugar pill. It could contain fecal matter, poop, could contain anything. Now, that individual from taking that pill could say, oh, I'm feeling better. How do you know that pill actually made them feel better? You can't. There's no way of knowing whether or not that pill actually did anything to their biology or physiology that actually made them better. The only thing you can do is say, oh, well, I gave them this treatment and they became better. If you run this sort of test on any individual, you will get the same result with any treatment. So there's no way of knowing what fucking treatment could possibly actually work, because there's no randomized trial. There's no group that's there's no placebo control where one group gets the non-treatment, the other group gets the actual treatment, and you're seeing whether or not the treatment group is actually doing better. So if you're looking at just single individuals, you can give them any treatment. Some of these treatments might be extremely harmful. Some of these treatments might be beneficial. Some of these treatments might be nothing. But especially when you're talking about something like mental health, where you're just going based on somebody's subjective measure of well-being, you're just asking them, well, do you feel better? You could give them anything. You can make them eat rocks. You can make them eat mercury. You can have them take crystal meth. Anything. And you can get that result of, well, I feel better, my depression's gone, but there's no way of actually knowing if the treatment's fucking effective. That's why we need randomized trials. This is fucking idiotic. Like this guy doesn't understand the scientific method.
So I think Ayurveda leans more into that. So Ayurveda basically says, okay, if we look at individuals, there is no such thing as an independent disease process that exists outside of an individual. That every disease process gets personalized when you stick it in a person. And so their approach, so I personally think that if we want to see proper outcomes from Ayurveda, we can never do an RCT, because their whole system of medicine is that depression in me and depression in you is different, which, by the way, it's really fascinating that we're moving in that direction. I'll get to that in a second.
So again, just to reiterate, if Dr. K actually believes this, then he would have to concede any treatment for any individual does work. So when you hear people say, oh, my depression or my energy or my health improved on a carnivore diet, that means the carnivore diet worked. Oh, if my illness was cured because I took homeopathic medicine, that means it actually did it. Which, again, if you're talking about just running an experiment on one single person, you couldn't possibly know that.
But what I think we really need to see for Eastern medicine, the right kind of study is actually a cohort study. So what we really need to do is take a cohort of people, give them Eastern medicine, cohort of people, give them allopathic medicine, and see who has better outcomes.
Why would it need to be a cohort? It could be a randomized trial, or it could be a cohort.
Well, that's not a cohort.
What do you mean?
In a situation where you'd randomize people and you'd say some of you want to do a comparison cohort as opposed to give someone true Ayurvedic treatment versus a sham.
No, I'm talking about cohort studies. So a non-inferiority trial between traditional allopathic treatment and Ayurvedic treatment. Because the whole point is that when their system of diagnosis presumes that there is not a treatment for depression. And then what we do is we take that thing, we remove all the individuality, which is a core part of their system of medicine. So their whole system of medicine is that, so there's even so for example, they believe that, I'm extrapolating here based on my expertise, but if you look at depression, there are 3 subtypes of depression. So there is neurovegetative depression, right? So difficulty getting out of bed, things like that. Then we have anxious depression. We recognize these as 2 clinical entities. There's a really interesting third subtype of depression called depression with anger attacks, where the primary manifestation is frustration and anger as opposed to feelings of sadness. Now, the really interesting thing is if you look in Ayurvedic medicine, they say that there are 3 dominant elements. There's like the earth element, there is the wind element, and then there's the fire.
Oh my god. Here we fucking go. Yeah. Earth element. Oh, of course. Eat dirt.
So if you take this depressive pathophysiology and you stick it in someone who is a predominant earth type, you will end up with a neurovegetative depression. If you stick it in a person who's a wind type, you will end up with an anxious depression. And if you stick it in a fire type, these are like Pokemon, you will end up with a depression with anger attacks. So even in their literature, they have these 3 subtypes of depression built out, and they say that it correlates with something about your alleles and how they manifest, your phenotype.
I think we're talking about...
No, they don't. There's no mention of alleles or genetics in Ayurvedic medicine. Like, again, it's ancient.
2 different things. I think Ayurvedic medicine does fantastic observation.
Yeah.
Like what you're describing is they've observed different
100%.
stuff. And I think you're going to get amazing validation even when you check.
By the way, this is so insane. Different alleles or genetic phenotypes can lead to the same clinical outcome. You could have depression that's related to like serotonin receptors or dopamine receptors or norepinephrine receptors, but the different pathology in which causes the depression could lead to the same subtype of depression. So how in the fuck would you be able to treat those different forms of depression with the same type of treatment when the pathophysiology is different?
Like individuals, when you do good observation. I think when you say we should do a cohort study to see if it is not inferior, to me, that's the same thing as an RCT. Like, it's not the gold, like for us, an RCT is the gold standard, right? But we have levels, a hierarchy of evidence. And cohorts are still up there. It's not just mechanistic, right? Like if you do a cohort study.
But a cohort study and RCT are 2 completely different study designs.
I agree, but in terms of weight of evidence,
Fine.
they're high levels.
No, but a weight of evidence is fine. But what I'm saying is that the RCT as a study design is antithetical to the system of medicine.
Sure, and I'm just using RCT because it happens to be the gold standard. Let's take cohort, let's take RCT.
How would a cohort study solve this problem?
All the higher levels of evidence, they're not done for Ayurvedic medicine, at least the majority of it. So granted, we can't do RCT, but we can do cohort. Those things aren't done. So I feel like we are taking what they're doing and you're seeing it as a leaning towards story, towards observation, away from the evidence-based model. And I see it as full one-sided.
Well, I don't follow you.
This is fucking retarded.
For example, you were talking about the art of medicine. I think that there needs to be a cautious balance between taking good quality evidence, whether that's RCT, cohort, etc., and then balancing that with the individual in front of you. But I think in Ayurvedic medicine, we're just having...
I'm going to leave a comment. This guy you're talking to is a clown and doesn't even understand the terms he's using, nor does he understand the scientific methods he's talking about. All research is correlational, but he doesn't seem to understand this. He also claimed, what was that claim he made? He also claimed we need to have randomized trials on single individuals. How can you have a randomized trial with one person? He doesn't even understand what this research is. The way he talked about individualizing medicine and experimenting on single individuals would also validate literally any treatment. You could feed someone poop and they could claim their mental health improved, but that doesn't mean eating poop helped their mental illness. This is why we have placebo-controlled randomized trials. You can't validate a treatment. Yeah, you can't validate. Sorry, you can't determine the validity of a treatment on a single individual. What a fucking moron, dude.
Being full-on art.
100%. So there are...
That's not 100% because they are taking into observations and all that.
So, I mean, I'm sort of addressing the questions you're asking, but I am not a proponent of Ayurvedic medicine, even as it stands today. I know it sounds kind of weird because I'm talking about it. So before this whole healthy gamer thing, my actual area of interest was evidence-based complementary alternative medicine. So there are all kinds of problems that we haven't even touched on. I mean, here you are saying, what about this, what about this? I can dismantle Ayurvedic medicine because there are fundamental weaknesses. The first fundamental weakness of Ayurvedic medicine is that you have no way to gauge practitioner reliability. The good thing about allopathic medicine is that, at least in the United States, if you finish a medicine program, there are standards that people can expect. If you go, you're a family physician, I'm a psychiatrist, but if two people have a heart attack on an airplane, they're going to get some comparable care, right? Even I can handle that some. So the biggest problem with Ayurvedic medicine is when you have this individuality, how do you judge the quality of a practitioner? How do you know ahead of time whether this person is good or bad, whether there's biases in their patient population, if their patient population has high socioeconomic status, and this practitioner is very charismatic, so they're engaging the placebo effect? How do you even know that their treatments are working at all? This is a fundamental problem with Ayurvedic medicine, which is that the good thing that we get, this is why I think allopathic medicine has grown so well, is because it is reliable. Ayurvedic medicine, I do not know that it is even 10% as reliable as the practice of Western medicine.
So if you think that, why do you discuss Ayurvedic medicine principles often?
Gerald Donatellas, do you have to track calories to maintain a lean physique? Well, you don't necessarily have to. There are people who can just intuitively eat, and they know if they're gaining weight or losing weight just based on how they feel. You can also track, you can do rough estimations of calorie tracking based on things like food volume. Some people just have a tendency to eat very little. Their appetite is low and they can just maintain a lean body weight. So you don't have to, but it helps. Thanks for the donation, Gerald.
Because I think there is a huge amount of utility to it. And just because this is, so if we can improve reliability on the Ayurvedic side, then I think we have something very potent, right? So, and the other reason is because I think that, like...
What is the thing that you think that's potent?
What do you mean?
You said that if we improve reliability, we'll have something on the Ayurvedic side that's potent. What would be potent?
So I think that they take this individualized approach. So in my clinical practice, the more that so I think we get taught in Western medicine or in medical school, we tend to get taught the population-based medicine way more. And like you said, we call it the art. Why do we call it the art? Because we don't have explicit systems. So the whole point is in
There's
Ayurvedic...
subjectivity to it. That's what art means, right?
Well, the reason we call it art is because we haven't made it scientific. Does that make sense?
No. What?
We haven't conceived of a way to make the art of medicine scientific, which is why we call it the art of medicine. But there's absolutely a logical...
What? Sorry? What? The art of medicine is not scientific. That's why we don't call it art. What the fuck could he possibly mean by this?
Scientific method going on in your head.
I think it's an art not because it's not scientific. I think it's an art because it's not standardized. And maybe I'm just
exactly. So
mixing words.
But that's exactly my point. Is we have not developed a standardization. We have not scientifically broken apart the art side of medicine.
I don't think that that can happen.
Yeah, well, so, there's a system of medicine that's done it,
which is why I recommend it. So
he literally just admitted that the reliability of Ayurvedic medicine isn't even 10% the reliability of modern Western medicine. And then he says Ayurvedic medicine has made the art of medicine a science. Like, what the fuck is this guy on about? Just, it's nothing but gobbledygook and word salad with this fucking moron.
What I'm saying is they've taken the
do you
individuality.
believe that though?
Yeah, absolutely. There's lots of flaws, but I think that they've done it. Yeah.
You mentioned we need to bring some of Western medicine into Ayurvedic practice to improve
100%.
Ayurvedic practice. I view that as not an optimal use of... That time is probably the wrong word. I would view, based on how you describe Ayurvedic medicine, that there's a lot of problems. 90% of it has issues, et cetera, et cetera. Why not take what works of Ayurvedic medicine, the art aspect of it, and bring it to Western medicine as opposed to bringing Western medicine and trying to fix something that is really very problematic, already so far gone?
It's a great question. So the first thing is that I think the question is sort of moot because I think both are happening simultaneously. So I think as we progress in our scientific understanding of medicine, we are moving closer to Ayurveda. So that's happening automatically because I think that as we're discovering more of truth, we're just moving in a particular direction of individualized medicine, which is the whole backdrop. So if you look at our Western system of medicine, the idea is that a disease process is independent of an individual and has a treatment. So the whole point of an RCT is let's remove all of the individuality, all of the specificity from an individual patient, because if we take an individual patient, we treat cholesterol in this individual patient, we have no idea how that's going to apply to the other 9,000 people we treat.
Okay, this is idiotic. If you're seeing better outcomes in a treatment group versus a placebo group, that means, on the whole, the treatment worked for most individuals. So it is personalized to an extent. Again, it's not expected that a treatment will respond the same way in every single individual. But again, that's the only way we have to validate whether or not a treatment works. You can't validate a treatment on one single individual. Again, I could feed somebody poop. I could make them eat shit. And then you could see their blood pressure go down, or their cholesterol go down, or their mood improved, or their depression went away. Does that mean them eating shit caused those outcomes? No, it could be a bunch of other things. It could be placebo effect. There could be downstream effects of eating shit that made them eat less or move more, and that lowered their blood pressure or cholesterol or improved their mood. You can't validate a fucking treatment on a single individual, you fucking idiot. If you believe that, then you'd have to accept literally every single fucking treatment is a valid treatment. You can make people eat shit. You can make people eat rocks. You can make people drink bleach. Like, this is shit that fucking crazy wackos do. And they say, well, it worked for my patient. Like, are you a fucking moron?
Because this person is an individual. So let's remove individuality from the equation. Let's look at
Oh my
high blood
God.
pressure, and let's try to isolate this disease process. Then we run into a problem in Western medicine because you can isolate this disease process in the laboratory, but the moment that you have a real person in front of you, things get complicated. Agreed?
100%.
So Ayurvedic medicine just looks at it from the opposite direction. They kind of say, okay, let's start with an individual and let's understand what works for this person. And then they also generalize. They sort of also have, diagnoses.
You can't determine what works for that person. Again, if you're going to go by the standard, then any treatment would work.
Right, which obviously means that it's not, there's diagnoses that are shared amongst individuals, but they start from a more individual lens. We are starting at a population level and we are trying to narrow down to personalized medicine. They start at personalized medicine and they sort of extrapolate out to a more general way.
Isn't that flawed by design?
Dude, like, what's hilarious here is Dr. K admitted that in Ayurvedic medicine, there's practices of eating arsenic, which is a heavy metal that's toxic. How do you think that came about? It's because idiots had this idea that, oh, we don't need to set up randomized trials. We just need to see outcomes in certain patients. And they fed them poisonous, toxic shit. And they found a correlation with this one individual that when they ate poisonous, toxic shit like arsenic, like they got a treatment effect from it, or an outcome that they wanted. That doesn't mean the actual treatment they got was responsible for the outcome they wanted. And even if it was, that may come with a lot of downsides that they're not able to actually see in the type of experiment they're doing. So, like again, with this sort of idea, you can validate any treatment. There are people who recommend drinking bleach, like turpentine, as a way to cure illness. Like, again, same fucking idea. These idiots, rather than setting up fucking randomized trials to see if there's an actual effect with the treatment, they just say, oh, well, try drinking this bleach. Oh, you feel better? Well, okay, I guess the bleach works for you. I guess with your dosha, you have the earth dosha, so bleach is good for you.
No. It's only flawed by design if you presume that the population base and the system, the existence of a disease process that is independent of people exists.
Wait, say that again?
So do you think that hypercholesterolemia can exist outside of a person?
Like existent.
What is that? Sorry, can hypercholesterolemia exist outside of a person? What the fuck does he mean by that? Hypercholesterolemia means you have elevated serum cholesterol. So, like, that's like saying, can GERD exist outside of a person? Can high blood pressure exist outside of a person? What the fuck does that mean?
In what way? Like, on the definition of in a textbook, you can.
Okay, so like, can you have hypercholesterolemia outside of a person?
Yes. And
What does he mean by that?
Okay, right, so when you translate that to a person, it becomes individualized, right? And then
Why? I still don't understand what Dr. K meant by that. What does he mean, can it exist outside of a person? It's a condition in your body. It can't exist outside of yourself.
our core pathophysiology, completely agree that you can say, okay, whatever, there's something that can exist in a petri dish. When you translate it into a person, you are adding individuality to it. maybe the word bias is good here. I don't know the way that you're using it. I'm not 100% sure. So all I'm saying is that the whole art of medicine is we have these general principles that are scientifically true, and we apply them to an individual. And then things get muddy, and we have to include the art of medicine, right? All Ayurveda does is they start with the presumption that a disease process and an individual, that every disease process is going to manifest in a unique way. And that is the foundation of how we are going to approach treatment. So if you say, is that biased in the sense that every treatment is individualized? Yes.
There's no way of knowing how, okay, there's no way of understanding the pathophysiology of the disease and whether or not the treatment's effective. Again, like, you could feed somebody bleach and then they could say their symptoms improved, and then, oh, well, I guess your unique biology means bleach is good for you.
I'm going to make a comparison. You familiar with bro science?
No.
So when you go to the gym and you hang out in the gym environment, there's a lot of guys that walk around to claim that they have the right way of exercising the right way. And it might be the right way for them. But if I in medicine try and take what worked for one person and try and scale it, I'm going to run into a disaster.
Yeah.
That's why I think it's better to look at population and then try and narrow it. That's why I think the principle of starting with one and going up and generalizing is way more problematic.
No, yeah, but so this is a fundamental misunderstanding. The whole point of Ayurveda is you don't generalize one to the broader population. You develop a system that works for each person ideally. That's what their approach is. There's no generalization.
You can't. That is impossible. That is the problem.
Or, I mean, there's some generalization, some necessary generalization, but their whole point is that when someone comes to you, and this guy is a bro science and he says this works for you, the Ayurvedic doctor says this worked for you, let me try to figure out, the next person comes along and they try to figure out what will work for you specifically. What will work for you specifically. They don't care about populations, they care about individuals.
And you don't think that's fraught with forever reliability issues?
What do you mean by reliability?
Again, like the practitioner reliability issues.
Oh, no, it's fraught with reliability.
That will never get solved.
I don't know that.
How can you have reliability when cults can lead people to do the most ridiculous things, feel certain ways because of the power of the mind to be manipulated? How can we ever measure what one individual is doing, whether or not that's valuable? Because I feel like it's so easily corruptible when we're just treating everyone as one.
So I think maybe I'm foolish. Maybe I'm...
So he could have phrased this in a better way, but again, there's no way of knowing with this type of experimentation whether or not the treatment actually did anything. Because you could see effects from a treatment that aren't due to the treatment. Like, again, all medicine is correlative. So if you have one individual and you tell this person, oh, well, pray to Satan. You see, Satan is this really powerful god that has power over your body. And if you pray to him to be happier, you'll become happier. How do you know that praying to Satan, this god, granted you happiness? Or say it could be anything else. Oh, well, pray for your blood pressure to get lower. Or pray for your cholesterol to get lower. You may, with this treatment, actually see a reduction in your blood pressure or cholesterol. It's possible. That doesn't mean the treatment actually did that, that it was actually responsible for it.
I'm optimistic. So here's where I'm coming from. Here's why I don't think it is an unsolvable problem. So if you look at the history of humanity, we've been faced with unsolvable problems that get solved. So I have faith that if we were to leverage even 10% of the brain power in scientific weight that we have in allopathic medicine towards Ayurveda, I think it'd be amazing what we would accomplish. That's my gut instinct. I don't know if that's true. Is it potentially an unsolvable problem? Absolutely. So what I think, though, is that what I've seen already is that it doesn't take a whole lot. So like I think that if we were to put, let's say, like put together like cohort treatments and we were to start to measure outcomes, so I do think we need to add some of this population-based stuff and evidence-based medicine. So let's compare Rasa Shastra, where someone gives arsenic and all this kind of stuff, to, for example, like Ayurvedic herbs or the inclusion of yoga and Tai Chi. Let's actually take cohorts of these people and study and see what's better and what isn't. And then I think what we'll discover is there can be a methodology, because they still teach general methodologies, but the focus of the general methodology is not on a disease, it is on a person. So in Western medicine, what we do is we make a diagnosis and then we treat the diagnosis. We don't treat a person. We don't ask, and then clinically we end up doing this, which is that we start to treat a diagnosis. But then as we actually treat a human being, this treatment of a diagnosis doesn't work like that. The person doesn't take their blood pressure medication. So now you have to have this conversation with them, or they have this kind of side effect, you have to change to this medication. So we end up individualizing. That's what makes a good doctor. All I'm saying is if you think about it, the actual...
Yeah, but the problem is you can end up giving a patient any fucking treatment and you could see success, but it may not be due to the treatment.
Well, theoretical, if you read a pathology textbook, which has all of our understanding of medicine, you will not find any art of medicine in there. You'll find it in other textbooks, but not in a pathology textbook. Then in the practice of medicine, we are adding what you call the art. And all I'm saying is there is a whole system of medicine where we take the RCTs and the population-based stuff in the pathology textbook, we add the art. But this is not the bulk of our approach to medicine. This is the bulk of our approach. Does that make sense? Ayurvedic medicine...
He's not making any sense. This is just lunacy.
So Mike, what frustrates you so much about Ayurvedic medicine?
I'll tell you why. It leads to a fundamental misunderstanding of healthcare for a large percentage of patients. It opens room for health gurus and hucksters to take advantage of people. And it actually diverts our attention from ways that we can improve medicine.
Okay. So now I'm understanding this conversation a lot better. So I noticed that this was becoming very antagonistic, which was really weird because I actually agree with the majority of what you're saying.
I see that.
Yeah, right. So I'm the first to kind of say, like, I'm the one who said, hey, like 90% of it I think could be crap. And so I was kind of struck a little bit. And then that's when I realized, like, I'm not talking to someone who has an open mind. I'm talking to someone who has a mind made up.
I'm talking about it from a truth-seeking perspective. So my mind's not made up. If you presented some data or information here that showed Ayurvedic medicine is way more accurate than you think it is, I would have changed my mind today.
Yeah, so it's interesting, but I think
I definitely have a bias.
Yeah,
from what I've learned so far.
How is this conversation for you emotionally?
Exciting.
In what way? So do you feel anything besides excitement?
Full excitement that we're finding a way to truth seek together. Because unlike many people who talk about Ayurvedic medicine in this space, I think you do it incredibly honestly.
So, because I agree with you, but I think there are a couple of things to keep in mind. So when you make a statement like, 90% of it is crap, that indicates bias to me because we don't know that. You make a very good argument that we have to be skeptical based on our understanding of things. That if I show up today and I say like, oh, like here's a pyramid, if you meditate under the pyramid, like it could work. And then you can always make the counter argument that until you study it, we don't know they could be right.
Right.
And what I'm also detecting from you is like, I think I'm detecting this emotion of frustration because of hucksters and these kinds of people. So I think your understanding of Ayurveda comes from these people. And so that's why I was kind of surprised because usually
That's not even the fundamental problem. Like, again, the problem is you have no idea if the treatment is actually having an effect. You can't possibly know that.
in conversations, I am representing your view a lot more.
Or
Right?
how
So
it's
I'll go to
having
these
an
academic
effect
conferences
either.
with a lot of Ayurvedic practitioners, and I'll say like, hey, like we don't know. There are 8 disciplines of Ayurveda. We have some limited evidence of this particular thing: Brahmi, turmeric, ashwagandha, like a set of herbs. We don't have a whole lot of stuff on this. And so I think it's just been really interesting. Now I understand a lot more why this conversation is going the way that it is, which is that you're asking me all these questions, which I get the sense that you're sort of open to the answer, but I think you're asking questions that are not open-ended questions. You're asking questions where you already have a hypothesis, and you are asking me to reflect upon that hypothesis, or even counter that hypothesis or support it.
That's fair.
Which is, I was just,
And I think our hypothesis is similar.
yeah. So I think though,
And our standpoint is similar.
I think that you would benefit from studying Ayurvedic medicine.
Agreed, which is what I'm hoping
No, he would not. It's just nothing but horseshit.
in this conversation to learn more about.
So I think just this individualized approach, it's so axiomatically different. I think there's value to it.
Without a doubt.
And in terms of why not translate it over, I think there are a couple of, I think that's good.
Okay, I'm done with this stupid shit. Dr. K is a fucking moron. Okay? The reason why medicine, that's what it's called, the reason why medicine uses things like randomized trials where you have population groups. Some of them get a treatment, some of them get a sham treatment, like a placebo. And you see which group does better. You see correlations between each group. And if the treatment group sees better outcomes than the placebo group, then you can say, the treatment actually worked. It has an effect. The reason you need that type of research is to actually determine if there is an effect of the treatment. You cannot determine that when you're looking at single individuals. If you have this idea that this idiot Dr. K has where, oh, well, you can take a single person, give them any treatment, and then if they respond well to the treatment, supposedly, then that means the treatment worked for them. You can't do that because there's an understanding not every treatment is going to react the same way in every single individual. So, and there's confounding variables like the placebo effect, diet, lifestyle factors, this and that, where you don't actually know if the treatment is what caused the outcome. So this will lead to people recommending things like drinking turpentine, which is a type of bleach. This is a thing people actually do. They actually drink bleach because they think it has some sort of fucking healing properties. So this Ayurvedic medicine bullshit where, oh, you individualize it to the person, that's the problem with Western medicine. It doesn't individualize. That's fucking retarded. We do individualize medicine to the fucking specific individual. We understand what works, what doesn't work, but we also have an understanding that not every single treatment is going to respond the same way in every single individual. So we adjust the treatment based on individual patient outcomes. How is that not fucking better than just throwing shit at the wall at any one fucking person and then saying, oh, well, I guess it worked for you. Bleach usually kills people, but for you, bleach is good. Like, this guy's a fucking clown. I can't stand him.
Not sure what this guy is getting at in the big picture. There is already an effort to personalize medicine by researching mutations and other biomarkers that exist in individuals and increase the odds of specific therapies being effective for them.
Well, yeah. Like one good example of this is Alzheimer's. There's certain gene mutations that are guaranteed to trigger Alzheimer's, and treatments are being experimented on those specific individuals. So if you have a particular gene mutation that causes a particular disease, we're researching that. Like the idea that medicine isn't made to be individualized is just fucking retarded. Dr. K is just a fucking moron. Like, again, he doesn't even understand the terms he's using. Like, he said there's a problem with some research because it's correlative. All research is correlative. Like, how is it not? He also fucking said, oh, we need randomized trials on single individuals. How the fuck do you randomize a single individual? You can't. Like, this guy doesn't even understand the fucking terms he's using. And then he'll just, like, fucking throw out these word salads like, oh, well, there's medicine and there's the art of medicine, but Ayurvedic medicine has taken the art and turned it into a science, so there's no art of medicine in Ayurveda, it's just medicine. Like, oh my god. I can't stand this guy. He's an absolute fucking quack. This dude is fucking dangerous. No wonder fucking Wreckful killed himself. If he had this fucking jackass as a doctor, holy fuck, this dude is a moron. But anyway, I think I'm gonna end the stream here. We've been going on for 5 hours now, so
Yoga is what.
tomorrow we'll probably react to some Hamza cringe and shit, and we'll see what's going on. Maybe we'll react to some Muslim stuff. But I hope you all had fun. Big thanks to everybody who donated in Streamlabs. Really appreciate it. And I'll see you all tomorrow around the same time. So, sweet dreams.